Hello, everybody. Welcome. Welcome to my dental family. I'm so excited to be with you, sharing some information along with Dr. Kapoor about Alzheimer's. Some of you may be thinking, well, you know, Alzheimer's. Why is Comfort is talking about Alzheimer's? Well, I'm talking about Alzheimer's because Alzheimer's has impacted my family. What do I mean? My dad got Alzheimer's when he was 85 years old. He died at 91. My brother has Alzheimer's now. He's 83. He got it 10 years ago. I've been thinking for many years, when is it going to be my turn? I walked around with this cloud over me, I'm doomed. I don't know when, but I'm doomed. What happened to me in 2017 is a friend told me about a book called The End of Alzheimer's. The End of Alzheimer's, that was written by Dr. Dale Bredesen. That book changed my life. That book gave me hope. And that book gave me a plan to follow so that I could prevent what my brother is going through now, what my dad went through. And so my intent here tonight, along with Dr. Kapoor, is to give you guys some hope and to give you a plan, give you an idea that you don't have to succumb to this disease. So Dr. Kapoor is going to begin the presentation, then I'll follow it up, and then we'll have some time for some questions afterwards. Enjoy this afternoon with us, and thank you again for coming. Dr. Kapoor.
Well, hello, everybody. It's nice to meet you. I'm Dr. Sandeep Kapoor. I'm a doctor over in Studio City. I'm a geriatrician. So I have been dealing with I've been in practice here about 20 years. And before that, I was the director of the Jewish Home, Los Angeles Jewish Home for the Aging in Reseda. So I have a lot of experience with older people, and people are used to say, why do you want to go into, work with older people? Well, it was a passion. But what I've evolved over the last 20 years is understanding, what I'm going to do about Alzheimer's disease or with dementia, because it is a disease that affects older people. And so I have learned over the last 20 years that, I have used every drug out there for Alzheimer's. I've used every medication, every treatment. When one of the new treatments would come out, I would be fighting to get it because I had people that needed it. And so I struggled to find ways. Did I have some successes? Sometimes. But what I discovered, just like Isaac, was that all of a sudden, in somewhere around 2017, around the same time, I attended a conference on the brain, and Dr. Bredesen was speaking. And it blew my mind. And I changed the way that I approached how I was going to treat. And I have hope. I had such amazing hope to deliver to my patients that there was another way. There was a way that Alzheimer's disease or dementia was not a given act of aging. I was sitting on the bus, one of those excursions on a cruise ship with my kids the other day in the Caribbean. And I was about 30 people on the bus, and I heard somebody in the front of the bus talking loudly. And he was saying to somebody else that he was talking to his neurologist. And the neurologist said that the chances of him not getting Alzheimer's, well, you may as well get hit by a bus because you're going to get Alzheimer's at some point. And I, to the embarrassment of my children, put my hands up in the air and I said, wait a minute, and I talked about, hey, wait a minute, there is a way to change the trajectory of what it is with your brain and what goes wrong with your brain. And it happens 20 years before, it happens 15 years before it happens. So the process starts before. And we need to figure out those processes, and we need to start to teach all ages on how to prevent Alzheimer's and how to prevent because we need to make it an optional disease. It is possible. It is not provocative for me to write this. Dr. Bredesen actually used this same title, and I lifted it from that. But he is making a difference, and I'm also on making a difference with the things that I do to try to enable people to live without having dementia. So I think we need to talk about the statistics first a little bit. There are about 6 million people currently living with Alzheimer's type dementia, and this is going to go to 14 million by 2050. Women and minorities are more likely to develop Alzheimer's disease than men. 2/3 of Americans living with Alzheimer's are women. And that's really striking. And we have to figure out why and what's happening with women. Poorer people also are more likely to have more socioeconomic status, are more likely to. So there's got to be a relationship, an understanding of why does it happen more to women, and why does it happen more to poor people? Is it food? So we have to figure out why. The economic impact of Alzheimer's disease. We all know someone who has it, who has of a family that has been afflicted with it. The amazingly astronomical costs of care. We're just talking about the cost of care, not about the emotional cost of destroying a family and destroying people's hopes and dreams of what it means to get older, and to recognize your children and to recognize your grandchildren, the golden years, right? So it is the economic cost of $305 billion, also from lost wages, spouses, caregivers, who are all charged with that 36-hour day. So it behooves us as a society to sort of look at what else can we do when, a patient of mine had a problem. A patient of mine recently just came to me, and he's scared for me to do a cognitive assessment on him. He doesn't want me to do an assessment on him. And I said, why? Why are you scared, John? And he said, well, my friend of mine went and had a cognition evaluation, and she came out without a driver's license. Now, that's all she came out with. I mean, so the fear is what holds people back from understanding that we can do something about it. So that's one of the things that I have discovered. So there's a lot of people having it. So what is dementia or Alzheimer's? So dementia is kind of that broad topic, that the umbrella that covers all types of memory loss, right? So it's that big umbrella, right? And loss of memory function, things that disrupt daily living. But there are different types of dementia. So Alzheimer's is one of them. Alzheimer's disease is about 50 to 75, 80% of those people who suffer from Alzheimer's disease. And that's based on a lot of studies and looking at things like amyloid and protein buildup in the brain. So the majority of those cases, but there's a growing evidence that we've got a lot of things that are vascular or blood. 20 to 30% of the cases are vascular. So that brings up like blood vessels, heart disease. We're seeing a lot of heart disease. Obviously, that's the number one killer of Americans. So the number one killer is heart disease. And that also, can you imagine that your blood vessels in the heart, and then there's also blood vessels in your brain. So 20 to 30% are in that area. And then that's the second most cause. And then there are others that you hear about: Lewy body disease associated with Parkinson's disease type of dementia. And then, of course, lately in the news has been the actor Bruce Willis, who is suffering from frontotemporal dementia, which is obviously gained a lot of press. And the family was very brave to be able to publicly talk about it. I think it brings the subject up. It's obviously it's a rarer cause. But again, the seeds of frontotemporal dementia occur very young, because the average age of someone who has frontotemporal dementia is around 60. So whatever was happening to Bruce Willis was happening many years before, and things that didn't get noticed before. And even doctors like myself 20 years ago, we're not doing the kind of thing we're doing now today. So technology has advanced dramatically. So what are the symptoms of dementia? Of course, memory loss is one of them that we see. Problem-solving difficulties start to happen. Things that, familiar tasks, difficulty completing tasks, confusions with time and place, visual spatial relationships. So understanding those. Visual memory is also, so visual memory and written memory, those are also tested. And those are indicative of dementia when you have both that are declined. Decreased judgment, that goes to driving and some of these more complex tasks. And then also, there's a lot of mood changes. I mean, the pandemic, right, has brought a lot of our seniors and a lot of us, forget about being senior, to new levels of stress and new levels of anxiety. And a lot of us have had some mood changes. And we wonder whether how much that contributes to our cognition or understanding. So we all have those days where we feel like, oh my God, I don't know what I'm doing. I might have Alzheimer's, or I'm worried. And what does this mean? And what does that mean? And does this mean I have early Alzheimer's? So people are scared and worried because it is something that is on the rise. And we'll talk a little bit about that. But so it's important that we look at all of it, mood and all of these things. It's important that we look at all of them. So are we smart people, doctors, neurologists, are we getting it right, the diagnosis? Are we figuring out which one it is? And the answer is no. And, there's a lot of graphs here, and just to basically look at these scans. These are PET scans, but really these are looking at studies. 40, here's a study where 42 patients were diagnosed with Alzheimer's disease by neurologists, and only 40% had positive PET scans that indicated they had Alzheimer's disease. And then when they looked at that information, they changed the diagnosis 60% of the time. That's really a bad, we love to diagnose as physicians, and we want to get it right. And the point is, we're not getting it right. But do we need to be right, or do we just need to figure out what is the underlying cause of what's happening and call it whatever it is? But if we can figure out what's going on in the root cause, which may be many different causes, then we can fix it. So the answer is, we're not getting it right. Even with experienced neurologists, we don't have, whatever it is, we're not looking and getting we're not getting the diagnosis right. So then we start to look at, I'm an expert in looking at genetics. I never thought I would be, but because of my involvement in integrative medicine, I became, somehow fell into it and became an expert, because using your genetics means I can determine, or what we call single nucleotide polymorphisms, not mutations, but variations in the genetic pool, can help me understand who is more predisposed and who is more likely to develop Alzheimer's. And maybe people have heard of this gene, the ApoE4. And this is the most common gene that is associated with about a 25%. So the 4 is one of the gene, there's two alleles on a gene, and one of them comes from your father, one of them come from the mother, and you come up with a combination. So when you have a protein, an apoprotein 4, that is one that increases your risk about 25% more than the general population if you have that particular gene. Now, it's not inevitable, right? So meaning that 25% just means you're at 20, you have a higher risk. For example, I did a genetic panel on a 32-year-old woman because she wanted to know her whole gene. She wanted to lose a little weight. She wanted to figure out her risk of diabetes, and very proactive. And she has 2 copies of this gene. So she's a 4-4. Some of you may know the actor Liam Hemsworth. He's a 39-year-old actor in Thor or something like that. And he has a 4-4 also. And so he was told he's 90% likely to get Alzheimer's disease. And what did he do? He went back to Australia and said, I got to take some time off to figure it out. He never has to have Alzheimer's disease. That's optional for him. He's 39 and he's healthy. There's a lot of time. There's a lot of things we can do to make sure he doesn't express it. So we have to look at beyond this. We have to look at least 300 more genes. Why do we have to look at 300 more genes than ApoE4? Because I'll explain to you, and you'll know more than most physicians know, actually, by the end of this talk. And I'll do it real briefly. So the 4 is the one that I told you has a problem, is the one that is the problem. And essentially, amyloid is that protein that gets all the tangled up, and it's a bad protein, and it gets stuck up in the brain, right? So that's what causes the memory loss. So the reason why is because the protein with the 4 is shaped like a sort of A shape, right? It's small, and so it can't shovel the amyloid up as easily as a normal allele here. The 3 is like a wide nunchuck, and it can kind of like shovel up the amyloid. So therefore you have much more ability to bind this gunk called amyloid up and take it out, right? Also binds up cholesterol and takes it out. So this is the theory understanding why they're not able to clear it enough. So what is amyloid? The question is, how does amyloid get there? And why? And is it something we eat? Is it like cholesterol? No, amyloid does not come from outside the body. Amyloid is produced by the body. Amyloid is produced in response to inflammation. Amyloid is produced as the brain's trying to protect itself from the toxins and from whatever else we're doing to eating or whatever we're doing. So amyloid is built up over the years, and it's an immune response. So the idea is that we want to make sure we don't evoke that immune response. We want to make sure that we keep everything nice and calm so that we don't build amyloid, right? So regardless of that. So that's the ApoE4 in a nutshell. And now here's a real picture. So why is it so important? Here's Dale Brederson. So here's his paper about ApoE4. This is that amazing neurologist who inspired me and Dr. Confortes to really understand that there is something we can do. The ApoE lipoprotein binds to about 1,700 different genes in different areas of the body involving the brain, inflammation in the brain, and it could cause cell death, aging. Aging is even associated with it, and sugar and diabetes. All of those interact with different hormones, also interact with it. So 1,700 other different types of processes. So that's why it's so important to look beyond just one gene. And so we have to look beyond that to see what we can do to basically decrease inflammation, stop cells from dying in your brain, and make sure that the connections between the neurons are sharper. So that's how we approach it from a system problem, right? So for example, how do we address ApoE4? Well, there's a lot of evidence. Diet, right? So just eating a Mediterranean diet with fish and fruits and vegetables and clean eating, it's definitely documented in numerous studies. How do we address that? We just eat anti-inflammatory, and it can reduce the risk of mild cognitive impairment. By the way, mild cognitive impairment, you hear a lot. It's called MCI, is a precursor to Alzheimer's. It's like a mild. So we want to catch everybody in their mild phases so that we can have more chances to change the diet. So, it's not easy to change people's diet, especially, believe me, in older age. It's really hard to give up that ice cream, right? But when you see maybe younger age too, but I mean, it is, when you see the writing on, when you see what it can do, when you give it up. I mean, I gave up sugar. I have my genes and I know my genes. I don't have the ApoE4, but I have other inflammatory genes and brain inflammation. So I've changed my diet and I don't eat sugar, and I don't eat it because I feel better when I don't eat it. So the Mediterranean diet becomes a very, sort of addicting when you have no brain fog and you improve your memory by eating all that good stuff without processed food. So that's one of the ways you can do it. There's so many ways to do prevention of Alzheimer's disease. I just put a couple of things up here just so we can have some, as I said, the Mediterranean diet, absolutely there. Physically active, physical fitness is and not just for cardiovascular health, it's for brain health, and being engaged mentally, whether it's work, beyond work though too. I think we need to be doing puzzles, hobbies, those kinds of things when it comes to mentally active, social connections, interactions with people. That was one of the things that was super problematic during the pandemic, as one of the reasons that we've seen a rise in Alzheimer's disease throughout around this time after the pandemic, because there were a big break in social connections, isolation, people staying in assisted livings literally were jailed because they were not able to leave their rooms. They got their food in their rooms. So, by getting people interacting again is a way to reduce the risk, right? And then below here is kind of like how we get into understanding why visiting your dentist is important, why doing things that are having a proactive approach to your healthcare, high blood pressure, cholesterol, diabetes, hypertension, all of these things, can be linked to an increased risk of Alzheimer's disease. So managing these conditions through lifestyle and, in fact, medication, right? So I am not someone that just says, well, we can do your blood pressure with, natural methods. If you can, you can. But if you can't, because that's a disease of aging or it's a disease of cardiovascular disease, let's use the great medications that we have. We have a lot of good ones. So there are several things we can do. What I say is pre-code to be able to, and these are also things we can use in treatment. But let's talk about a specific kind of, let's talk about brain inflammation. So it just mentioned earlier that brain inflammation is one of the causes of Alzheimer's and inflammation in general, right? So when Dr. Confortis tells you the inflammation in your gums is not good, well, that your gums are close to your brain, right? So you can imagine. So we'll just talk about one horrible inflammatory marker called tumor necrosis factor alpha. That's just one example of a gene too, that it's a genetic. Some people have genetically higher levels of this. But food causes tumor necrosis can activate it, right? So if you've heard of rheumatoid arthritis or other types of things, those medicines that they advertise for autoimmune diseases like rheumatoid arthritis are tumor necrosis factor blockers. So they literally shut it down. So that's what they do, is they shut down inflammation. So that's part of what happens in the brain. So inflammation in the brain is really, it wreaks havoc, right? It can lead to a accumulation of those abnormal proteins called amyloid, another one called tau protein. Excessive inflammation can lead to all sorts of diseases like cardiovascular disease, all sorts of different diabetes, metabolic issues. Microglia are these types of cells that are in between the neurons that protect the brain from infection, injury. But what happens in Alzheimer's disease is an inflammation. They can become overactive, overactivated, increase the inflammation, and results in sort of some toxic substances reduced. The inflammation, as I mentioned earlier, can lead to the tangles and the plaques called amyloid, which are the hallmark features. That's what you see on autopsy. When you do a brain, you see a lot of this amyloid deposition, and those can trigger more responses to inflammation. So inflammation is not good for your brain. In fact, there's a study here. So CRP and interleukin-6 are two important markers of inflammation that I do routinely with blood tests. And here's a study from a British journal, study, a Journal of Neurology in 2014 that looked at people in midlife, right? So higher inflammatory levels of CRP and IL-6 in midlife, which is, the mean age, the age of the people in the study were 55. I'm about to turn 55 in a few weeks. So if they had a higher chronically elevated inflammation, they had a 2 to 3 times increased risk of dementia than those they actually follow these people for 20 years. So they did studies, and this is why England, they do great work and research, because they were able to follow people for 20 years, and they found that 2 to 3 times increased risk of dementia 20 years later. So it's in their 70s. So when you say to someone, well, I'm not old enough to worry about inflammation or what it might affect on the brain, you can show them this study and say, hey, I heard that 2 to 3, you have a 2 to 3 times increased risk. So now is the time to develop an anti-inflammatory way of eating, an anti-inflammatory way of living, and make sure you get your levels checked. You don't always have to get an interleukin-6 or an IL-6 check, because that can be expensive, but a CRP is a routine part of my physicals that I do as a primary care doctor. You should ask to have that checked. What are the causes of CRP? Well, that could just be, it could be diabetes, pre-diabetes, heart disease, metabolism issues, weight gain, obesity. A lot of things cause inflammation that becomes systemic. We all know what inflammation is, because when we hit our hand, or we have an accident and we cut ourselves, we get bleeding and we get pain. And hopefully we got platelets and we got things to glue it up. But at the end of it, if it resolves, it's nice, right? It's supposed to be there. Otherwise, you wouldn't have any response or any healing. But when it doesn't resolve and it keeps going, that's when there's another. It doesn't get better and doesn't get better. So if you go to McDonald's and have like a Big Mac and a whole thing and a shake and all that stuff, your CRP levels go up, your inflammation levels go up. And then hopefully your body's like, okay, fine, you're done with that now, and he won't go there again. Oh, he went there again. And so went there again, and it goes up. So you do that chronically, and it becomes a problem. And this was independent of whether you had heart disease and whether you had. So this was a very telling study for me, that was like, well, we got to really pay attention to my younger patients who are maybe even experienced brain fog in their 40s and 50s, but they're inflamed. And so we got to get them not inflamed, right? So, even just to talk about COVID, right? So this is a 2021 study that was looking at inflammation and COVID and Alzheimer's. They showed that, sick people who are 65 and older who had COVID-19 were more prone to developing Alzheimer's disease in the year after their COVID diagnosis. That's horrifying, because and these are people, even they had mild symptoms. You didn't have to have really horrible COVID. But so we're looking at post-COVID and older people. Post-COVID syndrome could mean Alzheimer's. And that's why we need to address the issue of what's happening after COVID for all ages, but more so in terms of, and this was seen in women first observed in older women, at least 85 years old. So, these were striking values that are just coming out. So, it's unclear what COVID-19 to trigger. We're still working on that. We're still working on figuring out what that means. I mean, most of us have had COVID. Most of us have been vaccinated. And we all had different experiences with COVID and different experiences with the vaccinations. And so we still just don't know what that means. So we just know that we just get yourself checked in terms of your inflammation levels and make sure that you are doing that. So this is where I'm cued. This is just a cue to look at the teeth here to sort of tell me that, there's other things that, that what you do in the dentist chair is your vision. What he's looking at, what Dr. Confortis is looking at, is your cardiovascular disease risk, your metabolic risk, your Alzheimer's risk by looking in your mouth. So it's a potent way. And one of the things that Dr. Confortis and I bonded over is just our same common desire to be able to connect as each of us is a specialist in one area, but we're really body specialists, right? So we're looking at the whole body, and we're looking at how can we make a change, or how can we make a difference that will actually benefit heart disease. I mean, he is helping us reduce heart disease and brain disease. So this is why we're actually on this podcast together, is to be able to effectively work together and join forces. I didn't think, you've got a problem with your tooth, you go to a dentist. I didn't think about that. That wasn't what I was trained to do. I'm like, well, stay in your lane. But our lanes have crossed. Our lanes are now we're on this 7-lane highway. We all changing lanes and back and forth. And so hopefully it's not the 405 and 101 interchange, which is a big mess. So, so I leave that to Dr. Confortis, is that sort of segue to see what he has to say.
Thank you, Dr. Kapoor. I'm so grateful to have this opportunity to collaborate with Dr. Kapoor, because he's an expert in this area, and that's what I look for. I look for experts in other areas from our patients, so that I can collaborate and bring to our patients a different level of health and wellness. So, what is dentistry's role in Alzheimer's? Some of you may have thought, what does my tooth got to do with my brain? What does the mouth have to do with my brain? Well, first of all, let me just say that the majority of people out there see their dentist more often than they see their medical professional. That is 20% of the population visits the dentist more often. So what? What does that mean? Well, what does it mean for the dentist is that the dentist has an initial opportunity to possibly pick up on something that could contribute to the person's having Alzheimer's. What do I mean? As you come into the office, usually you check in, you say, hi, I have a 10 o'clock appointment. And then you have a seat, wait a few minutes to be brought to the treating room. Well, if somebody falls asleep in the reception area while they're waiting, it makes me start to think, well, why is that person tired? What are they doing there? And if they're in the treatment room and they fall asleep, and I come in to say, hello, how you doing? And they're asleep. Well, why are they asleep? So that gives me an opportunity to talk about sleep. And I can ask this individual, you seem really tired today. Did you have a bad sleep night, or what's going on? Tell me about your sleep. And if the conversation is such that person says, oh, I can't, I have a horrible sleep. I can't fall asleep, or if I fall asleep, I get up a bunch of times. I gotta have to go to the bathroom. I snore. I'm in a different room. My wife, wants to get a divorce because I'm just snoring all the time. Well, why is that? Why is that an issue? Well, maybe there's an issue in the airway. That's why this person can't really sleep that well. So what are we going to do? We're going to look at do an evaluation of the airway. Now, remember, when you go to sleep and you lay back, normally, as you take a breath in, it goes through your mouth, it goes into the lungs, and that's normal breathing. If, for example, your tongue was to go back and cut that airway off, you're not going to get the proper amount of air. And if you don't get the proper amount of air, this could lead to some other issues for you. So I'm going to do a clinical exam to evaluate. And why is this important? It's important to get the right amount of breathing because you need a certain level of oxygen. The brain is very, very dependent. That is, the brain cells, the nerve cells are very dependent on oxygen. And most of you know that if you were in some kind of accident and you couldn't get oxygen to your brain, after 5 minutes, you're going to be what? They're going to call you brain dead. Those nerve fibers are very sensitive to oxygen, and you have to have a certain amount coming in all the time. So I'm going to look at inside the mouth. The first thing I look at is the side of the tongue. Do I see little projections on the side of the tongue? Here's another view. They're little points. That usually is indicative there's some type of airway issue. What else could be contributing? What other anatomy do you have that could contribute to having issues getting the proper air that you need? Somebody has a very large tongue and blocks the back of the throat. That could possibly minimize the amount of air that you get in as you're going to sleep. What else? This is what I want to see. When I look in the back of the throat and I say, I want to see a nice open space like this. This will allow you to take in a breath properly and get the oxygen that you need into your lungs that are going to go into the bloodstream, that the bloodstream is going to carry oxygen to the brain. The brain needs to function. It needs it for energy. The mitochondria need that oxygen for energy. What else? Do you have tonsils? How big are the tonsils? Are they cutting off the airway? That's important to note. You have a large muscle on the bottom of your tongue. If there's a large muscle then there, it will prevent the tongue from being in its proper position at rest. What is the proper position at rest? The proper position at rest of your tongue is to be behind the upper front teeth. When you have a muscle like this, it keeps the tongue down and back. Down and back is not a good place to be in order for you to get the proper air that you need, especially during sleep. Look at this individual. Not only is there a large muscle, yet this individual has excess bone on the inside of their lower jaw. Well, what's the tongue going to do? It has no place to go. It only goes one direction. It's going to go back. Well, back is not good for breathing. What else? What's the palate look like? Is the palate V-shaped? Is it really narrow? Why is this important? Again, this will confine the space for the tongue, makes the tongue look for, where's the space for me? Well, there's space for me if I go backwards. Oh, that's not good for breathing. So if we see these things, and if the person is telling me, you know what, I can't really, I have a hard time sleeping. I don't get enough sleep. I'm always tired. We're going to recommend a sleep study. There's ways to help this individual. The gold standard has been the CPAP. All of you are familiar with the CPAP. Dentists can make an intraoral device that helps position the jaw in a different place, more forward, so that you can get more air during sleep. Myofunctional therapy is another way to train the tongue, and also jaw surgery is available to position the jaw in a more forward. So everybody knows CPAP, okay? This works really well. Unfortunately, CPAP, less than 40% of the population can tolerate a CPAP. If you can tolerate it, it's a great way to get what you need. This is a device that I mentioned about positioning that a dentist can make about positioning your jaw in a more forward, that is the lower jaw in a more forward position during sleep, which allows the airway to stay open so you can get proper air. Myofunctional therapy. I've done this. I've done it. I still do it. I started doing this 3 years ago because my tongue, and I had sleep apnea. My tongue, I would wake up, I'd have a dry mouth. My tongue was way in the back of my throat. I learned how to do these exercises and I retrained my tongue to be where it's supposed to be. As I said, in rest position, the tongue should be behind the upper front teeth. And jaw surgery is another way to get more airway dimension, more volume available. And that is the jaw, the lower jaw is brought forward, which opens up the back of the throat, allowing the person to get more air into the lungs. What else can dentistry do for patients to assist in not ending up with Alzheimer's? Mercury. Silver tin alloy filling has mercury in it. If Dr. Kapoor is doing an analysis of somebody and he does a test to see if there is high levels of mercury, well, we need to know, is it organic? Is it coming from fish? Or is it coming from inorganic source, which is a silver filling? If that is the case, then that silver filling will need to be removed. Removing that filling has to be done in a very safe way. And that is done under a rubber dam, which many of you have experienced that in the chair. Not only do we put on a rubber dam to protect the back of the throat, but we also will protect the nose. We use the high vacuum suction to suck up any of the particles that are being removed as that filling is being taken out. We also it's really about the vapor. We don't want the vapor. We don't want you to get the vapor. And that's really very, very important. Obviously, we don't want the particles being swallowed. So that's how it's taken out in a very safe manner. And then you guys know me, I like gold. So we use gold in the back, still do gold, love gold, great restoration. What else could dentistry do? Help in periodontal disease. Help manage periodontal disease. It still blows my mind that this is the 6th most prevalent disease in the world. A lot of individuals, a lot of adults have this. It's a chronic inflammatory disease. There is no cure. We help you manage this disease. And many of you know exactly what I'm talking about. Does this individual have issues with their mouth? Yes. This happens to be my brother. Unfortunately, my brother has mild cognitive impairment. My brother is a patient of Dr. Kapoor's. He used to have such meticulous hygiene. It's so painful to see him like this. He does not brush. And the facility he's living at, you can see the kind of care that is being given. It's painful. But not everybody is in this situation. Now, you may have a friend or a colleague or a loved one that says, hey, how do I know I have gum disease? Well, you don't have to have them come to the office. You can do a simple test yourself. You can buy these little, what's called soft picks. It's this little plastic tool, if you want to call it. It's about 1 inch long. You just take this and you place it between your teeth and go back and forth, go in and out. Do this a few times. And as you're doing this, if that area starts to bleed, well, your friend, colleague, your loved one, they have gum disease. Okay? So there's no question about it. So we establish if someone has gum disease. How do dentists do this? They use this periodontal probe, this little ruler. And it's used to measure around all the teeth. It gives us an indication of where the bone level is. It gives us an indication of where this person has gum disease. If we're going around the mouth and somebody is bleeding to this degree, there's no question. You don't have to be a science, you don't need a science degree or a dental degree to know this person has gum disease. But gum disease is a bacterial infection. Okay? The bacteria that live in this little space that we use our little ruler to measure, this is the key. Where these little bacteria reside, we don't know which bacteria resides. We don't know what the level of bacteria is unless we do a salivary test. And many of you that are here this evening have had this done. You know what I'm talking about. Very easy test. For those of you that don't know it, there's a little vial with a solution that's on the left side. You just put it in your mouth, switch it around for 30 seconds, give it back, put it in the container. We send it off to the lab. We get the results back in 7 to 10 days. We look at 11 bacteria. We don't look at 500 plus bacteria that are living in the mouth. There are 11 bacteria that have been studied for many, many years. These bacteria contribute to Alzheimer's, cardiac, diabetes. The ones that are the heavy players are the red zone and the first one in that orange zone. Those are the heavy players. And since we're talking about, Alzheimer's, the one that is the biggest culprit is called P. gingivalis. This one is the one that will create amyloid production in the brain. Dr. Kapoor talked about amyloid and how that messes up the memory aspects in our brain. It clogs things up. So we need to know, do you have P. gingivalis? If you have it, dentistry can help you get rid of it. You guys all know about the use of these aids, a water pick with a antimicrobial agent, excellent way to help control bacteria. Many of you have had gum therapy in the office, so you know what that's all about. And trays. This is the game changer, the hydrogen peroxide trays. I use this myself every day. This has made my bacteria load brought way down. It's helped me tremendously. I've had gum disease my entire life, just like I've had sleep apnea. I wear an appliance. I use the trays. What I recommend to my patients is no different than what I do for myself. The other thing is, if you can't tolerate the trays, or you say, and I have a few people that say to me, well, I'm not going to wear that thing for 15 minutes. Forget that tray. Give me something else. Well, the something else is you can use an oral probiotic. An oral probiotic means it doesn't get swallowed and go into your gut. It's an oral probiotic. You put it in your mouth, you let it dissolve. What this does is it supports the good bacteria in the mouth. It doesn't kill off the bad bacteria like hydrogen peroxide trays, but it will support the good bacteria. So that's an alternative if you don't want to do the trays. This is what I love to see, pink, healthy gums. I take my ruler, I go around these teeth. There's no bleeding. There's no number past 3. That means the bone is intact. This guy is healthy. But where is the bacterial level? This is beautiful, but what really matters is, what is the salivary analysis going to tell me? When I see a result that comes back like this, I'm jumping up and down. This is what I want to see. I want to see no threshold bacteria coming up high, especially P. gingivalis, since we're talking about Alzheimer's this evening. This is a great test. This is what we strive for. So dentistry's role in Alzheimer's disease. We have the initial, that is, dentistry has the initial opportunity to pick up little subtleties that may contribute to this path of going down Alzheimer's or memory dementia, whatever you want to use, what term you want to use. The dentists are the ones that can evaluate the airway, and the importance of oxygen saturation is critical for brain health. Dentists can do that. MDs do not know about airway. Mercury toxicity, we can eliminate that if that is an issue. And obviously periodontal disease, the big one, periodontal disease with P. gingivalis, we can help you get that under control. Thank you so much. We're going to open it up to some questions.
Hi, this
Hi,
is
Steve.
Steve. Steve Templer. Thank you both. That was spectacular. I do have a question. I have myasthenia gravis, as you know, Dr. Confortis, and it's caused by an overactive immune system. And I take medications for both. And based on comments early, Dr. Kapoor, is that also put me at a higher risk, or is that not necessarily?
Well, certainly, I mean, myasthenia gravis, I mean, I've seen a lot more than I wanted to see. Autoimmunity in general is, why do those antibodies start attacking those cells, like those muscle cells, and make myasthenia gravis? So it is a form of an autoimmune disease. You take medications to dampen or modulate the immune system. So certainly in the area of understanding that the immune regulation is dysregulated, yes, it is a risk factor for cognitive decline, or not necessarily Alzheimer's disease, but autoimmunity in general breeds inflammation. So support in that area would be to manifest a healthy gut. I mean, all these areas that you could do while managing your myasthenia gravis. Get the body to be a little less angry at itself.
All right, thank you so much. And we don't eat a pure Mediterranean diet, but we're fairly good with it. So I know that helps. My wife, unfortunately, is the queen of inflammation. Sadly, Dr. Confortis knows that well.
And modulate it and support your immune system. And just in general, there are many ways to just add to supporting your immune system, because Alzheimer's dementia is a dysregulation of the immune system. So there's ways to support it.
Mm-hmm. Okay, great. Thank you so much.
Our next one is Susan.
Hi, doctor. Hi,
Hi,
Isaac.
Susan.
So Isaac is my dentist, and I have one of those trays with the gel, and I love my trays. I use it every day too. It feels so good. It's so refreshing, and also it's making my gums healthy. I'm just curious what I have high cholesterol. I mean, I'm hoping to get it down with my next checkup, but I'm just curious why high cholesterol, how that affects Alzheimer's. Is there any correlation between those?
High cholesterol is a risk factor for cardiovascular disease in a sense, but it also can lead to increased risk of vascular dementia. So we do look at cholesterol in terms of like, is that plaquing up the brain? So definitely it is a risk factor for vascular disease in general, or blood vessel disease. So we do want to make sure we've got a good balance of the good and bad, right? So it's more than, nobody gets Alzheimer's from a shortage of Lipitor, right? So, a deficiency of Lipitor. So it's not about like necessarily like, well, you've got to be on a medicine for it, right? There's a lot of things we can do. I lowered my cholesterol by actually lowering my sugar intake. So it's a very fine balance. So absolutely you can manage your cholesterol, and it's not about always about eating, fats, and, it's a little bit genetic. It's a little bit, but there's so many things you can do about it. So it is a risk factor, but more so in the cardiovascular area and in the neurovascular area.
My doctor said stroke. She said I had an increased likelihood of stroke at my age because of my cholesterol, and I almost had a stroke while she was telling me that. So I changed my whole diet, and we'll see how my next blood test goes. But that's what they're talking about.
Mini strokes are also those things that cause us to have vascular dementia. Those are little tiny little strokes that can occur. And so those are important. So of course, I'm looking at stroke prevention also along with it. But it's not about fear. Knowledge is power, and you're already in that knowledgeable area of, hey, I got to do something about it. So you've changed your diet to a positive way. So up the good.
Cheese is dead to me now.
Yes, well, yeah, I mean, unless you're going and getting that goat from France and importing it and giving the nice rat.
No, it's dead to me now.
Okay, good. Yeah, it doesn't do us any good much. It's too saturated.
Thank you.
You're welcome.
I think that's it. Well, thank you, everybody, for attending this little get together. I hope that you gained some knowledge, and I hope that that you could be more at rest in your mind, knowing that there's something you can do, and you don't have to go down this path, and you don't have to have that fear anymore. And I look forward to our next meeting together. Have a good night. Thank you, Sandy.